Very honored to have Dr. James Miller here. He is hot off of Fox and Friends, which is where I saw the clip, and then found your story on a Midwestern doctor Substack, which I should show people in a second because I think it's a great Substack account if you're interested in some of what's been going on over the last couple of years with COVID. Dr. Miller, you and I originate from the same place, the west side of the Cascades in the Seattle region of Washington State. I'm on the east side now. You fled to Florida. We can talk about that in a second. You were working at the hospital that had the first confirmed case of COVID in the country. And that was where this all began and kind of unraveled your medical employment in Washington. And you are now, like I said, in Florida, and I want to get into your choices for your personal life and everything later because it sounds very interesting, especially the fact that you have an organic garden. That's very cool. Could you start with let's go back to like that first case. What was that like? Because I remember talking to doctors. I was in the middle of Washington. I hadn't moved all the way to the east side. I was in Cle Elum, which is just over the mountains from Seattle. And we were kind of like, all right, everyone was sort of freaking out about it, but we didn't really know what was going to happen. I think I was more concerned with the reaction. In fact, I said this on my channel at the time. I was more concerned about the reaction people were going to have to it than I was about what COVID was itself. And I think maybe that was a well-placed concern, even now, 2 years later, 3 years later.
Right.
What was it like that day that you all found out you had that case there?
I mean, it was nothing like it, these things happen, weird diseases roll in. There's an isolation room at the hospital, and yeah, stuff like that happened. I mean, I sort of heard about it by the by. It wasn't my specialty. I was a trauma surgeon and an ICU doctor and not an infectious disease doctor for viruses, but I heard about it and people were like, yeah, this is interesting. We're, made the news, and patients, really nice person, and we're sending lots of blood to the CDC. And so that was it originally. But that was way before we had a rise in illnesses and way before people just went mad. And so initially it was like, it's life. I mean, there's always infectious things that happen that sound scary if you have them uncontextualized.
Okay, so we're going to go into the topic in a second. I titled it Unvaxxed Got Worse Hospital Care. But before we get into that, what kind of doctor are you? What kind of medicine do you practice? And then we'll get into that topic.
Yeah, so now I'm a family doctor. And when I was in medical school, I wrestled with being a surgeon versus a family doctor, and did part of a residency in family medicine, and then switched and did a surgery residency. And I love surgery, and it was good. But I never really got outside of doing family medicine. I did really well in surgery. It was a fun job. But after everything deteriorated and I watched medicine not be what I thought it was, I didn't want to have anything to do with it. And it was a combined madness. It wasn't just about the virus. It wasn't just about the virus response. And you're so correct. The virus response was like so many multiples worse than the actual virus. It's beyond even discussion. But I watched the reason go out of medicine with this diversity, equity, and inclusion stuff that just wrecked people's ability to call truth, the trans stuff that became so oppressive. You couldn't even like talk to people. We had, and so the COVID.
Okay, hang on a second. I got to stop you there. Okay, how? Granted, you're north of Seattle. This is Snohomish, Washington, right? So you're north of Seattle. So it probably isn't necessarily the same, though. Maybe you've seen similar things in Florida. I'm not sure. But what do you mean by that? That it had gotten so oppressive in a hospital setting that you couldn't talk to people? What does that even mean? Especially like in trauma ICU care. Like what? How does that have anything to do with the care that you're giving?
Last couple of years before I left, there was a diversity officer kind of chasing me around the hospital, and we never met because people tried to protect us. We were close to one of these transition centers in Seattle. And so, something that people don't talk about is basically all these kids try to kill themselves while they're transitioning and after they're transitioned. And so as a trauma hospital, you get them, they decide to smash their car into something or hang themselves or, something. You just see these kids a lot and they're confused. And so like one time someone on my team, the patient in 10 minutes called themselves like multiple genders. And so one of the other doctors said he or she, I don't know. And like a dietitian was offended. And so our entire team got written up and forced to re-education camp. So like you can't talk like as a normal thing. And I don't mean to be like, sound like a knuckle dragging surgeon, but like, if they've got boy bits, they're a boy. And you refer to them like, I mean, yeah, you can use their name, you can use their pronoun, you can use their preferred pronoun, but if you slip, it doesn't mean you're like negating them as a human being. But then when like your dietitians are writing you up and there's a diversity officer saying you're all a bunch of like Neanderthals and you should lose hospital privileges because you dead named someone or misgendered someone or whatever, it just, you lose track of reason. And we saw this, like, this is just one facet. And that's part of why this was also difficult, is we had so many facets happening simultaneously.
Okay. I had to show this because I remember when this article came out, there was a lot of criticism. I mean, not from corporate news or the legacy press or the powers that be or anything. They all thought this was awesome. But in my world, in the alternative media world, people were looking at this article. This got passed around quite a bit. Teens who received gender-affirming care had 60% lower odds of depression, UW study finds, and that the study found gender-affirming care provided to teens at the Seattle Children's Gender Clinic likely reduced rates of depression and suicidal thoughts. And there were people who wrote critiques of this study. One thing that I told my editorial board audience is that a lot of folks don't realize that Seattle Children's included, hospitals, like, they have paid programming on TV news stations. In fact, our Health Link report is like a co-sponsored Seattle Children's, I shouldn't say our because I don't work for them anymore, but it's a co-sponsored TV report. And hospitals are constantly sending out press releases to make their stuff look good. You could talk probably about that as well. But I just had to bring that up because, I mean, the media just runs with the stuff you're talking about. And we can get into that too. And we've got so much to talk about, how the media teed up exactly what you saw in the hospitals with what you're talking about related to gender issues, but also the COVID issues. I mean, just the lack of critical thinking and voice to the alternative dissident ideas. That's one of the things that blew my mind looking at my industry, and really why I got into this world of starting to talk about it, because I was doing Airstream videos really when COVID came around. I mean, I didn't necessarily see myself as wanting to be a media analyst. I was just, hey, here's my Airstream, and I have a garden now finally, and I didn't want to do this stuff, but I just started seeing how crazy the world was getting around me because there was so much information. I want to call it propaganda, really, that was coming out of my old industry. Like, okay, well, somebody needs to tell folks how little we know about what we're talking about when we go on the news every day. I mean, we just go on the news like we're authorities, but we're not really authorities. We barely have scratched the surface in a lot of what we're talking about. And frankly, there's just a lot of group things. So, okay, where should we go back? Should we go back to COVID real fast?
Well,
I have an insurrection in my producer ranks. Go ahead, Dr.
I segue with that, what you just splashed up there, and how gender affirming care reduces depression from the University of Washington. I believe the University of Washington had some of the leading models for COVID. And I think that your readers can realize the validity of both right there. Oh, Allison, you still there? So, the University of Washington, I think, has long since been a reliable source of information, and affirming, like I said, that perspective is as accurate as the UW COVID models.
Well, I guess that sums it up. Okay, you know what? Before we go any farther, let's talk about something that is actually accurate, and that is that these are the world's best wines, and you can support my work at the same time. I know Dr. Miller drinks Pinot Noirs. We're going to forgive him on this one. These are all Malbecs. As I say, the Malbec is the poor man's Pinot Noir, but it is a great way to support my work. You get 50% off the wines, 50% off shipping. They're all high altitude, extremist altitude. If you're not an extremist yet, or you haven't been labeled an extremist, Like I try to pretend like you're not living in your grandma's basement. I have a feeling you probably are. So do something with your life and get an extremist Malbec if you're afraid to do anything else. Okay. AllisonWinePromo.com. I got to put, yeah, of course. And my producer's here. What do you want to do? You want to say hi to everybody? Okay. Right when the wine, of course. Okay. You know, she's her mother's daughter when she wants to come in when I do the wine read. Tell everybody to go to AllisonWinePromo.com. No. Okay. All right. Anyway, AllisonWinePromo.com. My favorite wines, high altitude, Argentina. Middle one comes from the oldest vineyard in Argentina, over 200 years old. If you like coffee, go check out twinenginecoffee.com/Allison and get a light roast, a dark roast, a medium roast, or you can even get tea. I actually have my Katura tea in the fridge right now. It's the tea that you brew from the fruit around the coffee beans. Very good. Low to medium caffeine, high antioxidants, tastes like black tea. Very good. Great going into summer weather. These are all awesome gift ideas for that special mom in your life. You know that after dealing with you, she needs a great glass of wine. Maybe she's exhausted and she needs a great cup of coffee. So go check out my sponsors. Really appreciate it. They're one of the main ways that I stay in business, get people like Dr. Miller on to talk about these crazy things. Let's go back to COVID. I know we've gone a little off topic. Let's go back to okay, you get this first case.
Mm-hmm.
You talked a little bit about how insane the culture was in the hospital at the time. When do you start noticing, when does the vaccine start becoming part of the conversation in the hospital?
That was actually way later, and we had jumped off the cliff of critical reason and critical talking by that time. Because we actually did have a problem with the virus in the hospital, where it's like it was serious. And that was the first week of March, maybe second week of March. And then, like most things, it passed and we were doing fine, except then it hit the news. And then all of a sudden the fear porn happened. And then the hospital did these really bizarre things to gin up fear with the staff. And when we actually had sick patients in the hospital, they put up these signs that said, if you wear PPE, we'll fire you. And we had all these memos that if you, and they very dramatically removed all the PPE from all the hospital wards and locked it outside the OR and put video cameras around it. And that only charge nurses could get out like a certain number of PPEs to deliver, okay? And I mean, being the fact that I'm like a literate doctor, I knew it didn't matter for, potentially airborne virus to wear a mask either way. So I didn't really mind, but I just thought, why do we make everyone so afraid by taking away the PPE? If it makes someone more comfortable, like just relax, let them be. Anyway, hospital took away all the PPE. And then obviously like about 3-4 weeks later, then PPE was mandatory and you lose your job if you're not wearing PPE.
Yeah.
But either way, it divided the staff and made people crazy. And these are some of the stories I've never heard anyone say. So like, I'm naturally not someone who enjoys, talking in public on podcasts or whatever, but I just realized like no one's really talking about this that was so self-evidently horrible. So yeah, no, I remember the day when we passed our inflection point and COVID itself wasn't really a problem in our hospital. And it was well before April of 20. And so, but that was just as the PR, the propaganda was winding up and making everyone so afraid. And I had mentioned in the Substack, I knew we were in trouble when for a hospital to be profitable, they have to have about 85% full beds, including in the ICU. And, usually our hospital was a profitable hospital. And with all the kind of shutdown, our hospital, we were running like really low, like well under 50%. I would even say probably 30%. And so, but we had full staff. And so we had to send people home. So we were in the middle of doing this, and you can't really send home your trauma surgeon of the day or the ICU doctor of the day because someone needs to do something in case an emergency happens. You can send home like 80% of the nurses, but you need a few of the skeleton people. So I was sticking around, drinking coffee, laughing. And the paper came out and it said, I don't remember the date. I'm sorry. And I tried looking for it and they may have taken it down off their site, but it's the local paper. And local ICU overwhelmed. And I'm like laughing. It's just like, it's this comedic as taking away the PPE and you lose your job if you don't have PPE to you lose your job if you're not wearing PPE. It was like nuts, but there's so much to laugh about in life anyway. So I was like, this is ridiculous, until I saw one of my colleagues who was in leadership panic and just be like, what are we gonna do? We're in trouble. And I don't even have an answer for that. And that's why, like, just the question, the unvaxxed got worse hospital care, like, to me, it's just such a self-evident, obvious thing. Like, I really struggle. So when I watch my, someone who I thought very highly of get up and panic and leave because we're overwhelmed, where we're sitting there looking at all empty beds from where we were sitting, and we were just waving goodbye to some nurses who were being low censused. Like, that disconnect, that just lack of, I don't even call it critical reasoning. It's just like, you know what I mean? Like, maybe I'm not explaining how preposterous this is.
Well, okay. So it sounds like to me, though, that what you're saying is something I think I hear from people a lot, which is COVID or the vaccine itself did not create the craziness that we see now with medical care. It was a symptom of something that had already existed. It arose from a system that was already, I don't know if you call it broken or just severely in disrepair, but it was just a symptom of something that was going horribly wrong already with medicine.
I think we were ripe because we were already losing critical reasoning. The fact that people would sign on to this DEI stuff, that we would sign on to, just turn your brain off and accept things. Then when we were like, again, the masking, not masking stuff, it was just so preposterous. Then once the vaccine came around, I honestly, personally, I just thought it was like a big practical joke until the vaccine came around. And then I started to see how serious it was. So the vaccine was first introduced in our hospital at the end of 20. And I was one of the first people who got it, actually. I didn't think anything because I thought it would be just as ineffective and unnecessary as the flu vaccine for most of us. And I don't mean to sound controversial. It's just, you deal with a lot of silliness in life. So anyway, I got the vaccine, whatever. My body totally did not tolerate the second one. It just spit it right out. I made jokes with my friends, because I had like just basically a draining wound for 2 weeks. And I was like, the microchip got spit out, and people laugh and stuff. I didn't have a stroke or anything. But after the vaccine got released to the population broadly, like March, April of 21, then things got bizarre, because we started seeing people, young people coming in coding with no explanation, and we couldn't speak of it. It was just like this dark perspective. And I don't have the exact numbers, but one of the nurses in leadership talked to me, and she said that approximately two thirds of the ICU nursing staff quit between April and probably August of 21. And the tagline that the media had says it was burnout. It wasn't burnout. We were sitting around not doing much. We were never overwhelmed. Like that, it never happened. All these ventilators.
Who is telling people that then? How are they getting that story? I mean, the hospital was setting up.
Yeah, hospital admin, like the head of infectious diseases doctor was saying all kinds of just mad things. They were so disconnected from reality. It's like, oh my gosh, I'm in a Vonnegut book. Like you're just like, what? This is surreal. I mean, the head of infectious disease doctor in our hospital, he told me privately that he was working on legislation to have unvaccinated people not able to renew their driver's licenses. And I mean, you have people like that in charge, and he was being boosted, and he was being put on the media, and he had a voice. And so you have people that have like that just truly stupid approach to public health and infectious disease in general, but public health particularly, and they're being promoted. And like, I was like, okay, you do realize you will have a civil war if you do that. And he just smirked and walked away.
Well, it actually sounds a lot like the attitude of at least one of my or two of my colleagues that I talked to. I mean, I already left the newsroom at this point. I got out in 2019. And so COVID wasn't really a thing till the beginning of 2020. But fast forward a year or so later, I was talking to a couple of my coworkers who are still there about what I thought was newsworthy stuff related to this. And one of them, who'd been in the business a long time, said he had no sympathy for the unvaccinated. So this just wasn't news, the stuff that I was pitching to him, which was crazy to me. I mean, one of them was because at the time, I mean, I'd just gotten fired from the Department of Natural Resources over my podcast. But one of the things that I saw while I was there, it was that we were potentially going to face a wildland firefighting issue because of the amount of firefighters that were not going to be on staff due to the vaccine mandate of the Commissioner of Public Lands, Hillary Franz. And so I thought that was interesting, especially for the guy at my old station who covered wildfires. You'd think that might be something you'd be interested in hearing about, but it wasn't news to him because he said he had no sympathy for the unvaccinated. I don't know what that has anything to do with your ability to do journalism, whether you think you should have sympathy or not. Your job is to explore the topic. But what that said to me from his perspective was, I'm not curious about this issue. I have no interest in exploring why these people are making their decisions. I'm not curious about it. I don't think it matters. They're just psychopaths who don't deserve any attention. That's what the news people were really thinking to themselves. I mean, they were totally all in on these campaigns, these vaccine campaigns, doing their live shots in the morning with the government. They had behind the scenes these partnerships with the Department of Health, where they're like, yeah, we'll stage this vaccine clinic. You could be out here in the morning and tell people they can come get their vaccine. And it was just really lack of criticism. Same thing you're describing. So it's a different profession, but it's very similar mindset.
Well,
Dr. Miller, I'm going to
sure
cut the YouTube stream in a second. And we'll be live, everybody, on the other platforms, ROKFIN, Rumble, Locals also. In fact, just give a shout out over to my Locals community. If you're interested in joining my editorial board, you get to put in questions ahead of time for interviews. There's a lot of questions we're going to go into with Dr. Miller. So head on over, $5 a month to go one-on-one with the most censored people on the internet. It's a great value. You get to ask the questions. It's a fun time over there. And you get exclusive content. There's an editorial board meeting we do once a week. I do it out with the horses usually. You get a live media analysis show with Bill Doris, also former TV news guy who people love to hate. He's my co-host on the show, and you get it exclusively too if you're a supporter. So go to alisonmar.locals.com, consider signing up. But I say this not because we're trying to evade censorship on YouTube, just because we like it better on the other platforms. So I just want to give everyone a heads up. We're going to be live over there, Rumble, ROKFIN, and Locals. But before we go, can you just sum up for people what the most, I guess, egregious forms of the medical caste system, I guess, that arose from these vaccine mandates, or the way of looking at the vaccinations in the hospital setting? Give us some like concrete examples of what you saw, and then we'll talk a little bit about how that led to your decision to leave ultimately. But let's start there. Can you give us some specific examples?
Sure. I talked about one example on Fox and Friends kind of interview that I did, and that was but there's some context leading up to that case, but it will reflect a bunch. But I mean, I think the overall theme is what you reflected, is that the media, the government, and the hospital administrators and leadership were all saying the same thing, that the unvaccinated people did not deserve normal care. I mean, and they did it with a cynical euphemism of, we protect our staff first, we protect our other patients first, and therefore you're not welcome in my clinic. Therefore, you have a different type of treatment. But the case that I talked about on Fox and Friends was one that became very personal for me because it was one of my patients. A lot of times you see these things going on beside you, but it's not your patient. And to give the background, I learned that most of the clinics in our town were not providing primary care to patients. And even though I was a subspecialist physician and provided just only acute care, hospital-based medicine, I was like, this is just wrong. And so we set up a clinic. It was kind of an involved story, and I'd be happy to go into the details. at the local church I was at in Calvary Chapel Church, and we
Oh
turned
yes,
our
we got to talk about that too.
we turned our church into a clinic, and we would see patients there. And because I'm a scientist, we did not wear masks. And
can you say real fast why you and the church opened this clinic?
Well, because people just couldn't get care. I mean, there was a patient, she became a patient of mine, but she was someone I knew in the church who got COVID, went to the hospital, was on oxygen. Her family doctor told her she wouldn't see her until she was vaccinated. So she left the hospital on oxygen, and her family doctor wouldn't care for that. She said, oh, just figure it out. If you know so much to be not vaccinated, figure it out. So like me and actually one of my kids who's a lawyer helped this lady draft a letter of complaint to the state board, because you can't, that's just patient abandonment. That's not okay. But it was being done, and it was approved like by the leaders. And all you have to do is go on their social media sites and see them boosting, the unvaccinated people. I mean, are basically life unworthy of life. I mean, it was like they were getting back to phrases from dark points in human history. And I was just like watching it before my eyes. And
Yeah,
I mean,
what about like the organ transplants? We were hearing people still to this day are being denied because they're not vaccinated.
Yeah. So I'm not a transplant surgeon. So I mean, it sounds dumb and evil and unethical, but I have not participated in those cases.
Yeah, it just that just seemed, I don't know, it's just another thing that just seemed very odd that came out of this era. Okay, continue with your, sorry, you were talking about that case or others.
Yeah, and actually, if I could just back up to the mask,
Sure.
just getting to know you before this interview, I watched you interviewed someone who's a mask expert, as an environmental scientist.
Yeah, Kristen.
And as she mentioned, there's been the definitive papers, and you mentioned in Cochrane Review showing that masks are not of no benefit. But that to me insults us in even asking the question, because all you have to do is look at the size of a COVID particle and look at the size of a mask particle and realize that it's like thinking you're going to strain your pasta with like a colander that has holes 400 times bigger than your pasta noodle. Like, that's the ridiculousness of it. And the fact that we've been debating this for years is just bizarre. But anyway, people came to it. We set up this clinic to care for people because people just weren't getting basic care. Like, I need my diabetes medicine. I have a sinus infection. And they'd go to the urgent care and they'd say, are you vaccinated? And they would say no. And they say, just keep driving. And so yeah, we set that up, and it was, I think, not popular by the medical community, who finally did learn of it, because I started seeing a reasonably high number of patients. And it was just an interesting time. I found that, I exercise regularly. I'm a huge advocate of exercise to avoid needing medicines for most conditions that ail Americans. But I found that I was stretched really thin because I was working full time, and then I was seeing patients in the clinic with kind of escalating needs. And it was tough. But the word on the street is that the hospital administration found out about this and decided I must go. In all fairness, they had some other axes to grind with me, because I had called out the chief medical officer for being part of a Medicare fraud scheme. So there were other reasons. And then I mentioned this in my Substack a bit, but it was so bizarre because I also bumped into this thing where people were falsifying medical records. To what end is hard to say. And one of the nurse managers was like, we need to get rid of Dr. Miller. And so I was falsely accused of everything, and when I decided to go public with this Substack, my wife's like, oh, I'm not sure I can endure another set of false allegations. And because it's hard, even though when you know that it's like a patent lie, it's hard to be called bad doctor. It's hard to be called unethical. It's hard to be called a racist. It's hard to be called, fill in the gaps. The racism one was actually one of the easier ones to beat, because they were accusing me of being racist to my own race. They aren't intelligent enough to know what my ethnicity was. So it was actually kind of funny when I was hauled in front of this panel to sign papers that say, you're a racist. And I'm like, I'm not. And we saw you have it in video. I'm like, you can't, because I wasn't. And I'm like, show me the video that shows that I'm racist. Like, oh, it just got deleted yesterday, but we had it. You have to trust us. And I'm like, I don't. But this is in front of like the chief medical officer, the guy who became the CEO of the hospital, the head lawyer. Like, it was a firing squad. It was just preposterous madness. They just wanted to just have my voice silenced. So this was even before COVID. So we were already unreasonable. But then after I opened up the clinic, they found something they could get me on, and that was microaggressions. And I've tried to explain what microaggressions are to people in Florida, and they just don't get it. Because when they've hauled me before these panels and said I did something bad, I'm like, okay, what? Did I, swear, kick, hit, bite? Did I do something wrong medical wise? Oh, no. But anyway, with the microaggressions, to prove a microaggression, all you have to prove is that the person accepted the information poorly, not that the information was inappropriately stated or untrue or something like that. So, if I were to say the patient has a hemoglobin of 5.5, and that's probably why they have chest pain, that is a microaggression because the person didn't like that number, and the way I presented it made them feel inferior. And so after kind of things spun out, there were some cases of microaggression. And the actual case is like comedic, because like I was taking care of a patient who had bowel ischemia. He was a young guy, breadwinner in his family. It was a simple operation that would take me like 40 minutes tops to take care of for him. I needed the patient under anesthesia though, because it needed to be done laparoscopically. And the OR staff is watching like vacation videos or YouTube videos and won't open the room. I said, we had plenty of staff. That wasn't the question. It was, there were no rooms opening in this business. This is like a 500-bed hospital. Usually we had multiple rooms running all night. And this is like 8 p.m. I'm like, okay, look, this patient has been waiting for hours. It's not acceptable. It's below standard of care. We need to like go. And they're like, that makes me feel bad. And I'm like, but the patient has peritonitis. That makes him feel bad. And anyway, that was it. They got me on microaggressions, and they decided that made me creating a hostile work environment. And then they did these parallel investigations that were such that people that I had basically helped grow their career, promoted them, helped them out, were afraid to answer my phone calls, wouldn't answer my texts, wouldn't answer my emails. I was the interim director of our team for years. Like I was like a very big part of what was going on. I was well known as being one of the strongest, if not the strongest surgeon. I had the highest productivity almost every month. And then all of a sudden, these people that you promoted, built up, they won't even talk to you because you're being investigated. Not that I did anything wrong. It was that I was being investigated. And the word on the street is that investigation was just secondary to finding out that I was running this COVID clinic for people who chose to be unvaccinated.
You mentioned that it's hard to be called a racist or whatever the other words were. Why do you say it? Why do you say that?
Have you ever had an accusation of racism against you?
Do you know what I do for a living?
No, well, sorry, I don't mean to put you on the spot, but it's horrible because like I am committed, like I've taken oaths to help people, and then to be accused of the opposite of that. It's exhausting and it's mind numbing. It's really hard to keep working when you're being accused of just all these things that have no grounding in reality.
Why? Well, if it's not grounded in reality, why is it? I mean, the reason I asked is just because I do hear that quite a bit. And I think it's an interesting question to explore, because probably at the root of a lot of the problems we're seeing today is that people do not want to stand alone and are nervous to be ostracized by their peers. So that's why I figured I'd just ask you, like, what do you think that is? Because I think that's probably at the root of a lot of the reasons why people stayed silent over the last couple of years and got us, into the situation that we're in.
Absolutely. And there were 3 physicians who were all older than me, so chronologically more senior, who said, James, what you're doing is right, and I support you. I could never endure what you're doing, and I can't be near you because I don't want the hate coming to me. So they at least had the decency to talk to me and say that. But yes, it's tough to be alone, and it's tough to just to go through this firing squad. And the way it's all set up, it makes you feel very alone because they drag you in front of like groups of 8+ people, and everyone just takes pot shots at you and tries to accuse you of like all manner of pathologic thinking. And but in this situation of the microaggressions, where I was standing up for someone that was like, of an underserved population who had like a genuine surgical emergency, and the people were watching like vacation videos or YouTube videos and not caring for them, like I never really felt bad. And that actually shined them on a lot worse, because if I would have just, done some chin scraping and said, oh, I'm so sorry, I misunderstood, I should have been, part of the narrative, all was forgiven, I was good to go. But there was no way that was happening, because it's just such a patent lie. So I'm not sure if that answers your question.
Yeah. I wanted to just shout out over to locals too, because I'm going to cut the YouTube stream and we'll go take some questions over there. Lots of questions coming in for you over there. I would say like one of the big ones I just want to throw your way is about medical personnel you've worked with and where they stand now, like SDB 52 here. Does Dr. Miller think more medical personnel will expose the medical insanity as they retire or quit, thus no longer have incomes in jeopardy, or have any of Dr. Miller's peers woken to the reality of what has happened from Who's Ed? Do you mind answering that question real fast? Just about your peers, I guess. Have you seen more, or is it about the same people who are kind of asking questions about all this versus the folks who are still going along with the narrative?
That's worded in a way that I haven't thought of. I struggle. You're getting into something that's a very strong personal struggle of mine. And if I can just give a little context of why this is so hard for me. I no longer affiliate with the American College of Surgeons. The day I was sworn into the American College of Surgeons was many years ago, and I think I cried. I was so proud, because they were so good and noble, and because they've gone so against everything reasonable. I no longer affiliate. I stopped paying my dues. I've taken it off of my CV that I'm a fellow. I no longer consider myself that. So part of it is I don't want to affiliate with these people who are part of it. I think, in all fairness, most of the people who were awakened early are proud of themselves, but it was, sub 2% of the physicians. I think that most all the other people, they just want to close their eyes and have it go away and just be allowed to do their job again. But I don't think there is the penitence, the reckoning that is necessary. I'm not sure. Does that answer the questions?
Mm-hmm. Yeah. It sounds like the answer is probably no.
By and large, no, because I think that what happened was a travesty of science. It was a travesty of ethics. The physicians who stayed have this cognitive dissonance that, like, I can't jump past it. And I think that one of the other parts is they have a moral dissonance. And this is one of the things I saw, with all of this ICU nurses who left and the massive quittings of doctors who were 50+. There was just this moral dissonance you had, where we have oaths, our eyeballs are telling us certain things, all of our professional societies, the government, what's expected of us, our employers are telling us opposite things. And a lot of people couldn't live. I mean, one of my close friends tried to kill himself. Another one of my friends, who is another physician, killed her mom, then herself. Wow. This is very real. And I think for a lot of people that are the physicians who've been speaking out, they've been speaking out because of the data, a lot of the scientists, high-end scientists. I'm not a high-end scientist, but the high-end scientists, they've been speaking out because of the data. For me, it's like, this is like a human casualty that we're not even scratching the surface of how bad it is. The moral casualty to the people who have stayed behind is unfathomable. I mean, these people are shredded. They know they're wrong. There's no question they know they're wrong. I can see it in their eyes when I talk to people, but like they're disconnected. And so there's a dissonance there that's not just cognitive, it's a moral dissonance.
Okay, on that note, if you're watching on YouTube, we hope to see you elsewhere.